Hi, everyone. Welcome to the first ever ConnexUS Live. It's a really exciting day. We're going to give a couple more minutes for those latecomers, those people who might be a little bit late getting their morning coffee on the East Coast or those getting lunch in Europe. But we're really excited to have you join us, and we'll be getting started in just a couple of moments. And you know what? I think that's just about enough time for everybody to join because we've had lots to discuss today. So first of all, welcome to everyone to the first ever ConnexUS Live event. Good morning, good afternoon. I'm really excited to be facilitating today's discussion alongside my colleague, Emily Long. And as this is the first ConnexUS Live event, I just want to introduce you to what ConnexUS actually is. So ConnexUS is a project of Search for Common Ground. It's an online platform for coordination and collaboration for responding to global challenges. And the platform was really inspired by the response to COVID-19 and the need to coordinate across sectors to create shared solutions to complex shared challenges. Since launching in January, ConnexUS has had users from over 100 countries across the peacebuilding, public health, development, and humanitarian fields. And even before we start today's discussion, we invite you to continue to visit the website, ConnexUS.org. There'll be a link in your chat throughout, and sign up to connect with practitioners, academics, researchers, policymakers, and activists in your community and from further afield. Now, my name is Jack Farrell. I am the Manager for Partnerships and Strategic Innovation at Search for Common Ground. I'm based in London, and I'm going to be facilitating this discussion alongside Emily Long, who is our Communications Officer at Search, and she is based in Washington, DC. So down to the nitty-gritty. Today, we're going to be discussing CDA Collaborative Learning Projects resource, conflict sensitivity and public health emergencies, practical programming adaptation during COVID-19 and beyond. Now, we'll be putting the link to the resource itself in the chat function. So this tool was developed in response to practitioner requests for guidance in addressing public health emergencies, conflict dynamics, and humanitarian needs simultaneously. Conflict sensitivity in public health emergencies is inspired by the challenges the COVID-19 pandemic presents, but it is also designed to be used in any public health emergency context and systems-informed application. Before we dive into our conversation, let me share a few brief notes about our format. As this is the first discussion, this is quite different from any discussion we've done before. And first and foremost, this is intended to be interactive. So I would like to encourage you to engage and share your knowledge and insights throughout the next hour. We're going to open today's discussion with a brief presentation from today's guests, and that will be followed by a live discussion with you all. There are two ways that you can ask a question or participate. The first is by typing in your question in the chat function, and we will read it out. The second is to click on the raise hand icon, and our team will unmute you so that you can ask your question or make a comment. We ask that all audience members remain muted unless you have been prompted to unmute and ask your question. Please note that this webinar is also being streamed on Facebook Live to give us some sort of room for overflow and for a different audience, and will be recorded for people who are unable to attend to view this event later. So with that housekeeping done, let's get started with today's discussion. I'm delighted to introduce our guests who will tell us more about the resource, how it has already been utilized in the field, and the practical applications it has for you and for all the other participants in today's webinar. So our first guest is Sabina Robillard. And Sabina, I'm so sorry, I butchered this. And Sabina is the Associate of Accountability and Humanitarian Aid at CDA. She is the primary author of Conflict Sensitivity and Public Health Emergencies, and has a range of experience in humanitarian, public health, and peacebuilding fields, specializing in the relationship between disaster-affected communities and humanitarian organizations. Sabina has worked with a range of international actors around the world. Joining Sabina in today's presentation is Ellie Maloba. Ellie is the Executive Director of Sera Tabiti, based in Nairobi, Kenya, and was an essential reviewer of and ongoing collaborator on the resource. Ellie is a passionate peace builder and trained social scientist, and is also a published cartoonist and visual artist with field experience in humanitarian and crisis situations, which he morphs into a work model that inspires and motivates him into insights for broader and deeper view of the world and its challenges. He is the co-founder of Sera Tabiti, a community-based organization in Nairobi, and is also now a consultant in peacebuilding. Ellie is also the 2020 Alliance for Peacebuilding Purdue Peacebuilding Big Idea Challenge winner and a 2012 UNDP Kenya Award winner, amongst many other things. So they are also joined by the one and only Ruth Rhodes Allen, who is the President and Chief Collaboration Officer of CDA. And Ruth initiated the project with Sabina when they saw a critically timed need. She has been involved throughout, so she will help Sabina and Ellie field questions when they arise. So thank you to Sabina, to Ellie, to Ruth for joining us today. I'm really excited to have you be the first guests on our ConnexUS live discussions. And with that, I'm going to pass it on to Sabina to get started with your presentation.
All right, hi, can everyone hear me okay? Brilliant. I apologize in advance. I have a toddler behind me, so there might be some unexpected interruptions. Thank you all for joining and for giving us a chance to talk about this tool today. Emily, would you mind going to the next slide? Thanks. So as you can see, this is, we're here to talk about a tool that we made called Conflict Sensitivity in Public Health Emergencies. As Jack mentioned, CDA is kind of a question-driven organization, so we respond to and try to work with the questions of the practitioners that are in our circle and our learning partners. And as the COVID-19 pandemic evolved, we kept hearing from our colleagues in the peace building and humanitarian space that they were struggling to figure out how to kind of adapt and understand and incorporate these new kind of public health crisis that is somehow in everyone's very visible in a way that others were not before into their work. And also their comments about how the public health response they felt could be more conflict informed. And so we decided to take on a initiative to try to consult with folks we knew who were on the front lines from the peacebuilding, humanitarian, and peacebuilding, humanitarian, and public health spheres, and get their sense of what was out there. What were they understanding about working at? I know there's a lot of talk about the nexus, but this particular nexus of crisis response, and we use that to elaborate this tool, which I'll be explaining really briefly right now. But it really was based on the conversations that we had with practitioners like Ellie, which is why it's so fantastic he's here. And so that's kind of where this all evolved. So we can go to the next slide. So one of the first things we did with the people that we spoke to was try to elaborate a kind of a concept map of understanding how public health emergencies, humanitarian crises, and conflicts might be intersected in terms of their driving factors. We elaborated this concept map. And even though some people have told us it looks like a plate of spaghetti, trust me, the original versions were even more complex. This is greatly scaled down from the initial maps that we worked on with the people that we consulted for the tool. And we don't have time, or there's not a necessity to kind of dive into the details of this or pick apart individual dynamics. The real thing we just wanted to emphasize is there is a lot of interconnectivity between these different crisis types and the drivers that we all work on in our fields. So conflict dynamics affect kind of key determinants of public health. Public health crises affect many conflict dynamics, and all of these things contribute to the vulnerabilities that we see in the context of humanitarian crises. So this was kind of the complexity that Jack mentioned in the beginning of this presentation. Probably for everyone here, this is not news. We know that this is complex. We know that these factors are interconnected because we deal with them on a day-to-day basis. But sometimes illustrating that can be really helpful. And that was the purpose of including this. And we could go to the next slide. So one thing that we, for public health practitioners, this quote was in the context of COVID-19, so hence why it is referencing a virus. But, we understand that health is not, we are not dealing with kind of medical or health silos. We understand that they are, when we're dealing with public health crises, we're also dealing with the enabling environment that is letting that crisis take shape and all the human factors that go into that. I saw this firsthand working on the Ebola response in Guinea in 2015, 2016, where a very medicalized approach in some ways made things worse because it didn't understand the complex conflict dynamics that were happening in some of the affected communities. Next slide. And for peace building practitioners, some of you might recognize this, as a kind of a feedback loop of conflict dynamics, having done conflict mapping exercises. And it's important to know that, these different aspects of a public health emergency or crises, they can exacerbate or at times lessen key driving factors, behind a conflict. So these were just kind of simple illustrations. Again, I think of concepts that I think based on the people who've shown up here, you probably already know, but it is important to understand and communicate to each other, why it's important to understand and recognize and the dynamics of crisis types and intervention types that might not be kind of where we're comfortable. So this was just an illustration of that. I'll move on, next slide. Those of you in the peace building field might kind of know, also recognize maybe not the shape of this graph, but the terms of this graph, whereas there's a difference between working in conflict and on conflict, right? There's a spectrum of intervention where everyone who's working in conflict, which is everyone because conflict is everywhere, knows that at the very least, we're trying to kind of do risk management, do no harm, be conflict sensitive, make sure we're not making things worse. And kind of as we go up this specialization ladder, we can start to more directly affect the key dynamics, that are contributing to conflict or peace. So kind of at the lowest level of kind of awareness and investment, we have, risk management, conflict sensitivity, all the way up to formal peace building. And we could do next slide. And we decided to apply this logic as well to humanitarian crises. Again, there are, humanitarian crises are not just, what we kind of think of as classic crises we see in the news. I think COVID-19 really showed us that vulnerabilities are everywhere, and kind of what we decide and determine to be a crisis can be a relative term. So in a similar sense to the fact that conflict is everywhere, real serious, needs and vulnerabilities exist everywhere. And so on a similar spectrum, given that crises are are all around us, we, at the very least, there needs to be basic understanding of kind of humanitarian dynamics to avoid, to do some risk management and avoid negative effects on actors and programs. And as you kind of go down that specialization ladder, you might eventually get into, what we consider more classic humanitarian action, where you're working on these crises to alleviate suffering. And then the last bit, if you can move on, next slide, Emily, we said was a similar sense in terms of looking at public health emergencies, where, again, COVID-19 has showed us those can appear anywhere at any time and are often ongoing around us without us realizing. At the very least, there's a sense where you want to make sure that, for instance, your intervention is not making your local COVID-19 response efforts worse. It's not having a negative effect on those actors and programs. And an ideal, and then inside of going down that spectrum of specialization, you have people who are public health specialists who are really working on restoring health and well-being to communities. And all this is to say that no one has to be an expert in all three of these domains. We really just need to know the basic vocabularies and building blocks and concepts of these different fields so that we can speak the same language, avoid making each other's lives difficult with programs that might have unintended negative consequences. And then ideally, we can leverage our interventions to help make positive progress on other types of crises and for our colleagues across different disciplinary divides. And we go to the next slide. So this was the kind of the logic and the ethos behind putting this tool together. Again, it's not just about mapping complexity and saying, well, you should know this and you shouldn't have to know that. There's a lot of kind of finger wagging that sometimes happens in these contexts. CDA is very kind of strategy and solution oriented. So we're trying to learn from people, like what would it help? What are some guidance and tools that could work, to help make things a little bit easier and introduce you to some of these different types of analyses. I also know, however, there's serious tool burnout in most of our organizations. So we in some ways hesitated even calling this a tool. In our minds, it's more of a conversation starter, is the logic behind this. So what we did at the back of the tool, after providing a lot of the conceptual mapping early on, was we write a series of worksheets that people like to help to help organizations work through maybe different types of analyses that are maybe they're not as familiar with. And again, it's not meant to be prescriptive. It's not meant to be one more thing you have to fill out, but just basically a conversation starter, a way to get the process going internally. So this is an example of one for, conflict mapping. If you're a public health practitioner who's not used to that, all of these we provided, hypothetical examples that were in a public health emergency context. Emily, next slide, please. Another one might be looking at something called connector analysis in a public health context. Again, we're not going to go into these. It's just an example of what some of these worksheets look like. In next slide, Emily. And this one is, looking at something called implicit ethical messaging and negative organizational outcomes. Again, just an example of different kinds of worksheets we have in the back of the tool. We also uploaded all of these online, the worksheets, so that you can download them in Excel and play around with them. Again, the idea is that this is not, we don't have the corner of the market on, how to go about these. Everything has to be adapted to both the local crisis context and your own organization. But the idea is just to put them out there as a basis for conversation, a basis to start to apply and explore. And on that note, this is really a pilot version of the tool. The idea was to get something out that was, while the COVID-19 crisis was unrolling and people were dealing with these issues in real time, so that people could apply the tool, give us feedback, give us thoughts on it, and so we could revise it, because this is not going to be the last global global health crisis that we're in. Conflicts and humanitarian crises are ongoing and getting more protracted. So we want to have this be refined by real world feedback. And even in the question of just adjusting, we struggled a lot with how technical jargon do we get into, how much, would we go into the weeds of these specific, words and terms that might be more proper in this field, but might not be understandable to another. So all of that was to say, this was our best chance of our best attempt at getting these things out based on practitioner feedback, based on those initial consultations. And we're really open and welcome to any feedback. I'll put my email in the chat shortly. And so I know we'll hear from Ellie, who was, not just a great, who informed the tool and also is helping to apply it shortly, but any feedback you have today, tomorrow, down the line, it's very much open. This is a living document, and we're hoping it serves you all well. So thank you very much for your time. Thanks to my toddler for staying quiet. And I now have the honor of passing on to, as you heard from his bio, a super impressive practitioner, Ellie Maloba. So
Ellie, we are having some microphone issues. I think we're having some technological gremlins on the line.
Am I audible?
And now you're coming through loud and clear.
Good. Thank you, Sabina, for that introduction and for setting the piece. I am a new face to quite a number of people, so I'll just make a brief statement. I'm Eli Maloba. I'm based in Nairobi. My work and career, mostly in peace building, has been involved in field practitioner. So I spent most of the time in the field, and I think my strength or my perspective, as you will note today, will be more on from the ground up perspective of the application of this tool. Like Sabina said, we got involved in reviewing this tool, and we are happy that as Sarah the BTU are involved, because it is one of those things that we've really wanted to really contribute towards. All in all, in the objective of actually having a stronger peace building impact on the ground. But given that this tool comes in handy because of the various practical considerations that actually we've seen or observed in the field. So number one, I think I'll just start with a broad statement that the public health emergency tool specifically just has come in handy in raising the bar on how we understand the vulnerability context in our programming. This is not to downplay the various roles and various other contributions in the field of knowledge and practice that are being made by other practitioners. Actually, for those who are not new in humanitarian field and peace building, you'll notice that the terms conflict-sensitive programming or approaches and do no harm are very common terms that are used in this field. But basically, in response to the emerging trends that we saw, and I think the coronavirus that hit us in 2020 is actually a very good conservation starter, and which informed part of, or if not most part of this work. We noticed that the general observation is that there's a deepening of the underlying causes of conflict, which actually has created new, if not proximate drivers to existing conflicts and other new conflicts. Number two, we noticed the raised risk associated with the new barriers that are being created, especially in terms of people who seek assistance from health facilities and health infrastructure. The third vulnerability we saw was how public health emergencies have also been associated with the promotion of rumors and conspiracy theories. And lastly, how it has really impacted by impeding ongoing and other containing measures that are in place. Of course, these are common observations across various fields, but there are specific lessons that would be applicable in this context. And based on that conservation, I think I'll try and allow me to use more of a people-centered conflict early warning perspective to this. One, like any other emergencies, the public health emergencies have implications on the individual person and also the collective. Basically, this is we can identify it in terms of the traumas that are observed both at the individual and collective level, and also the chain of events that are associated with public health emergencies. And if I was to give a very practical example, one of the common things that we see, especially in the least developed countries, is not only the strain on resources, but also the resource drain or the chain of events that, for example, would impact on an individual or society. For example, when you're tackling an emergency like the COVID or even cancer. One other lesson that we've seen is how public health emergencies bring about the need to repackage solutions. We repackage our solutions that are applicable in all settings. Actually, what the new term that is being applied mostly is contextualization, so that to address the conflicts that and the proximate drivers to conflicts that we see, we need to repackage solutions to cover all the aspects, whether be it at a global level, urban level, or even at community level, down at the grassroots, and even at the individual level. Of course, most of these tools that we've been using, like do no harm approach, rights-based approaches, and human rights approaches, are not new. But it's all about repackaging. Is all about making conflict sensitivity top of the health reform or interventions agenda. The third lesson that we've seen, but I'll just gloss about it, but it's more of the ethical considerations. And by ethical considerations, I'll not necessarily, I'll leave it to the audience to discuss it, but I'll just put it broadly that it's, we see more of the weaponization of public health emergencies and even the responses. The fourth lesson that we see relates to local ownership. And like I said, the debate or the fight, the impediment to ongoing and other containment measures is actually to do with local ownership. if I was just look at, to use a street level example, the discussions as to how to whether to put on masks or not to put on masks, and for example, how to respond to lockdowns and curfews and all these things, containment measures, has to do with local ownership and to what extent are these public health emergencies responses people-driven or targeted. The fifth lesson that we've observed is that public health or emergencies bring about overlapping crises and drivers and spectrums of, which actually necessitates a broad spectrum of response. So I bring this one. I think take note of this one, because I think there's a question that I'll pose that at the tail end of my presentation. The sixth lesson that we observed is actually how public health emergencies bring about the need to prioritize the use of everyday indicators, not just in mapping and analysis, but also in prioritizing the dividers and connectors that we use in our day-to-day work. Remember, like I said, that this is not a entirely new thing. You're not trying to reinvent the wheel, no, but you're just trying to pick out some of these gaps and opportunities that have been presented when we are now dealing with some of these emergencies. The seventh lesson that we observe is that public health emergencies necessitate a common approach so that we can able to cover ground. Like we observed, and I think most of you have these lessons that you've seen all in all. For example, the response, if I was to use COVID as a benchmark, the response at various levels, basically when at the time when COVID was discovered in Wuhan, China, the originator, from that time to the time when the WHO declared it a global emergency, and even the individual responses of various governments, and then down to various organizations, you could see that the need for a common approach is very necessary to cover ground, because public health emergency is all a matter of the response to make them to have a better impact, is basically to have that timing correct, and so to be able to cover ground to mitigate some of these issues that bring out conflicts. And lastly, one of the lessons, and this one is even more important because it will come back to the last question that I'll have, is actually the need for institutional self-analysis. And I think that one leave it to the plenary so that we can go about it. Now, granted that I've basically just picked out some of those key lessons, I'll try and just preempt some few things and go to some of the opportunities and gaps that we've seen. One, and I'll frame them in form of questions. For example, based on those lessons and the vulnerability context that I stated, one of the questions that we see, and you can also relate it to what Sabina has just said, is it also informs the objective of actually this tool that was developed by CDA. One is how can we better practice our commitments? Yeah. And if you're to relate to it, some of these ethical considerations that we've seen in our responses, and the need for common approach and institutional self-analysis, is like, how can we be better in practicing our commitments? Like I said, it's not a new thing. We're just examining some of these gaps that we've seen that would better make us better to respond to some of these emergencies. And this could be the commitments as a collective, or even at our own individual organizational level. And secondly, how can we have a better understanding of the local power dynamics so that you can increase effectiveness of our interventions? And those who have had this experience, you realize that local power dynamics in any intervention are very, very important. And they come more to play when we look at public health emergencies. The fourth gap that we've seen is which is now basically now the matter of this is the practical considerations and approaches. And I think probably in the lessons that I identified, basically picked some of them. What are the practical considerations and approaches for using this tool? And remember, this tool falls under the broader do no harm framework, which is not new also. And lastly, which broader principles of conflict-sensitive programming can be applied, so that not just in these public health emergencies, but also in the context of other disruptive forces and systems. And the public health emergencies, we just used identified that because of the burden everywhere, both in the local, in the global north and the global south. We've seen how public health emergencies how disruptive they are to systems. And like I said, if I was to use just an example of cancer as a situation, as a health situation in Kenya, cancer has really disrupted the health system to a point where that we have those long queues to even access treatment, and then at the end of it all, the futility of a family or an individual or even a collective using all their resources to a point where they no longer have any resource to even spare for their day-to-day living, and at the end of it all, the system still crashes and is not helpful. So that's another opportunity that we need to look at for. Now, based on those gaps, I think I hope I'm still on time, and I'll be brief again. There are these opportunities that we've identified. One, that yes, there is a changing, the need and the opportunity that is granted by the changing strategic landscapes. And we have various opportunities that are at play. And so how are we better at identifying these strategic landscapes that are being offered? And I think this tool is just a conversation starter to guide us to basically have that conversation of how to be strategic in response. The other opportunity is how to deepen the targets and that have been presented, and these targets are both lateral and vertical relationships and opportunities that we see. By vertical, we are looking at the long-term strategic planning and that is involved in response and in making these interventions and containment measures more effective. And bilateral, we are looking at the strengthening of the relationship that we have, so that you can have more efficacy and impact. The other opportunity comes in the planning. How do we get better at designing systems that are able to anticipate some of these emergencies, and not just to make these systems better anticipated, but these systems that are accessible by as broad as possible spectrum of actors, and even down to the individual level, where we talk about the local person understanding how this system plays into making better their own individual response to these emergencies. The other opportunity is in harnessing of data indicators. Like I said, one of the lessons that we've seen is the use of everyday indicators in mapping, analysis, and prioritizing. The dividers and connect us to response. But basically, how the opportunity presented is actually the use of everyday indicators. How involved are we in that? The other opportunity, but I will look at it more in terms of the threat that comes from misinformation threats. How better are we in tackling misinformation threats? And but when we examine ourselves and we examine the systems that are at play with each other, how better are we at examining the perceptions and biases that not only just inform our interventions, but also inform the responses from both the lateral and vertical spectrums. And like, for example, one of the things that we've seen with COVID is actually the mass hysteria, the impact of mass hysteria. And especially that is fueled by social media and other missteps that happen. Also, how do we broaden deeper ownership by making public health emergency not only a personal choice, but also an obligation, yeah, not just at institutional level, but also at individual level. And the other opportunity that is presented is basically in retooling. By retooling, this actually acknowledges that it's sort of new, but basically looking at what we have, retooling and restationing our tools that we are using. And lastly, the opportunity is both in governance and leadership programs that are run. And I'll finish by posing these questions. One, acknowledging that we are working in resource-constrained contexts, and public health emergencies are that, exact that, working in resource-constrained context. So the question I'll pose to you is, do we need dedicated desks or units? Considering that this is a multidisciplinary, the need for interdisciplinary teams, which works best? Yeah, where we have teams that bring their own insights, so that we can it allows for glossing into the nitty-gritties and also seizing for opportunities that come about. And the other question is, how do we go beyond contingency planning that we are all aware of? Given the time factor that is presented by emergencies, what will be the ideal starting point so that we are able to start on a sure footing? So with that, I think I'll leave it at that, and then I'll be able for questions. Sabina.
Thank you so much, Ellie and Sabina, for your presentations on the resource itself, and then the lessons learned and opportunities found from implementing it. We appreciate both the background on how it was developed and some of the practical ways that it was implemented. So as a reminder, we will now open to audience questions. And as a reminder, you can type your question using the chat function here in Zoom, or you can unmute. Sorry, excuse me, and we'll read it out to the audience, or you can click the raise hand button and we'll unmute you to ask your question. I will get started with a couple questions. The first one I'd like to direct to Ellie. While you were integrating the resource into your work, and you did speak to this briefly, but if you could go into what you found most difficult maybe, or the challenges, the primary challenges that you faced when implementing this resource in your work.
Thank you, Emily. One of the challenges that we've seen, and it's also an opportunity, is the need to be strategic across various landscapes, and I think in working in a resource-constrained context makes individuals, organizations very, very, very strategic about how they deploy their resources, and not just deploying the resources, but even how they address their competing interests, and in between deploying those strategic resources and addressing their competing interests. Usually time is lost in between that. And that goes back to now my question about the gap of how to better practice our commitments. It goes back to that commitment. Are we just sloganeering when it comes to our commitments to addressing some of these challenges, or to what extent are we being hypothetical in our work, and how are we practical? So that's one of the challenges. Number two, the speed at which misinformation threats are spread. Basically, not just in response to the interventions, but even from a practitioner point of view, where our perceptions and biases do guide some of these choices that we make. So, and that spectrum becomes even more challenging when you work in a multidisciplinary or interdisciplinary context, of which humanitarian situations and such as public health emergencies do require that broad spectrum of actors, of teams. So basically, in that context, then dealing with perceptions and biases becomes one of the big challenges. The last one, and I think this one also goes hand in hand with the broader challenge, is actually local ownership. Remember, we're talking about time and resources, working in a time and resource constraint context, but at the speed at which we need to make local ownership of the whole process a priority so that we have more impact in the response, so that we can lessen the risk of escalation or de-escalation to conflicts from these ideal agencies. So those three challenges, I think, are some of the broader ones. Emily.
Thank you so much, Ellie. I think the resource constraints and the spread of misinformation, the rapid spread of mis and disinformation has been relevant for all of us. I'd like to direct my next question. And again, the audience, you're welcome to put your questions in the chat or raise your hand. We'll gladly unmute you. To Sabina and or Ruth, you mentioned that this was a pilot resource. And so we're curious to know how you view this resource developing over the next few years, given this is, as we discussed, just a conversation starter.
Yeah, I'm happy to jump in there really briefly. I mean, something that strikes me with Ellie's comments, with some of the things Sabina presented, and just how we've heard from others in applying this. Whether you're writing a proposal right now, or whether you're a funder developing an RFA or looking for how to partner, the phrase COVID adaptations is now part of our lexicon the way that it wasn't a year ago. Like we were just starting to think about that, but now it's as common as, I don't know, currency exchange that you have to factor into your budgeting process or think about in your work planning and other things like that. And so, what we didn't know when we started the project was the how. Like, how is COVID actually, and other major emergencies, how did they impact that systems diagram that Sabina presented early on, and what do you actually do about it? So the phrase that we keep saying at CDA and with a lot of partners is the how matters. Right. And so what we're really trying to do with this resource and suite of resources, as Sabina mentioned, all of the tool pieces are adaptable to all of you and your partners. How are you adapting them? We want to know, what are you finding most useful? Because that we can build into future iterations, or where and how we share the resource for others. And really trying to make something, again, as practical and light as possible, but very impactful. And, something that I've observed, CDA works a lot in the local leadership space. And this has been something we've been, champions of for a long time. A lot of us are in these spaces and conversations trying to do the case making for local leadership. The case making is done. We're past that at this point. And so, how do we accelerate those kinds of values, those kinds of priorities? And things like this are supposed to be, intended to be, helping in this way. So if you're finding barriers to those goals, we'd love to hear about it. Like, where did we get it wrong? If you're finding success stories or completely new things that we didn't even think about, we want to hear about that so that we can build that in and continue to grow the community. I'll pause there, Sabina, in case there are other things you wanted to mention.
No, I mean, I think Ruth, you covered it all. And actually, that's a good reminder that I need to put my email in the chat right now, because I think some people are having to hop off.
Yeah, no, that would be great, Sabina. Thank you, Ruth, for sharing. And I think that this is very much an emerging space. And like you said, the case has been made for local peace builders. Everything should be sort of centered around the context and understanding that to make the biggest impact possible. And like I said, it's been an exciting shift to watch it happen over the years. And now it feels, like it's obvious, but for a long time it wasn't. I'm going to ask a question because I have a million. I wrote them down. Wrote so many down. So one of the things that both Ellie and Sabina mentioned was the importance of speaking the same language on with like public health practitioners, with humanitarian professionals, with peace builders. One of the challenges that we've had launching the ConnexUS platform over the last 3 months is that we've often hit a roadblock with the public health community. As soon as we mention conflict, they shut off. They don't want to engage. They're not interested in conflict. They're working on, you know, a public health issue. I even had an incident last week, and I told you, I told sort of everyone, sort of Ruth and Sabina and Ellie and Emily yesterday, when I was speaking with a public health practitioner about the goal of ConnexUS and the COVID-19 and conflict affected contexts around the world. He told me I was using public health wrong, and I need to be talking about global health. So there are nuances in language that we need to overcome. How have you sort of overcome this barrier to work across sectors, to sort of have that common response, as you said, Ellie? How do you work more effectively with these communities that, you know, don't speak the same language as you regards to the ongoing crisis?
Thank you, Jack. You know, the beauty of this concept that we espouse as CLBT is the prioritization of what you call a people-centric conflict early warning and early response. It helps us harness a broad spectrum of indicators. Indicators, and how these indicators, from the analysis of these indicators, how these indicators now conflate to the escalation or de-escalation of conflict. And it also helps us also analyze the roles of the broad spectrum of agencies or that are involved in a particular situation. So like I said, the need to have a common approach to cover ground is actually very, very important. And one of the main objectives of this tool is to help bring to make this what you call a top drawer, to bring conflict sensitivity to the top drawer of even these this health reforms and any other intervention agenda that we have. Basically, just the term conflict sensitivity sometimes throws people off track. But like I said, concepts like do no harm, rights-based approach, and human rights approaches as practical. And like I said, even going beyond contingency planning, the question would be, what are you planning for when you're doing responding to this emergency? What broad spectrum of issues are you planning for when you respond to these emergencies? And one of the lessons we learn in peace building is that peace building is not static. It is dynamic. Conflict is not static. It is dynamic, and so should be the responses. Like I said, the implications of public health emergencies on the individual, not just on the individual person, and also on the collective person, and also looking at the chain of events. Looking at the overlapping drivers and the spectrums of response makes it a common approach. I think that should be the question that we should be discussing across any other.
Yeah, and if I can jump in for a little bit on that. So I've had the opportunity to work in humanitarian response, in like response to the 2010 earthquake in Haiti, public health response in the subsequent cholera response in Haiti, and the Ebola outbreak in Guinea, and in peace building. Oh, okay, funny. Oh, sorry, 1 second. And we were doing so well.
That's wonderful.
And then also in peace building, working mostly in situations of gang conflict in Cité Soleil outside of Port-au-Prince. And what I have to say is that jumping between all those fields, I mean, once you're working with affected populations, those divisions that we think we have between this, our disciplines pretty much do not exist. A lot of
behind my back because it will hit you.
Oh, and so I think that's something that's really important to know, is that I think I'm also getting my PhD and I'm in academia. Like, I do know the importance of using proper terminology for the proper types of analysis, but in reality, there's, these divisions that we think exist do not. If you talk about, We've asked people the simple question before, like, well, what is health to you? Like, what is health? And for women in certain places, it's, it's questions of domestic violence and conflict, which is that is then their primary health concern. You have issues of, of environmental justice and discrimination, which, are inherently political. And sometimes humanitarians don't want to touch those things, but it's inevitably like the people are complex, communities are complex, their needs are complex, their priorities and resources are complex, and don't fall into these silos. I think it's on us in many ways to get over our, reserve our jargon for technical conferences and academic papers, but really, as Ellie said, if you have a people-centered approach and you're focusing on the systems and the environments and the complexities that people deal with on a day-to-day reality, the divisions between these fall away and almost make no sense to people who are navigating this on a day-to-day basis. So I do think that's really important to get across. And I think that's on us to work to overcome that, as opposed to making affected communities fit into our respective interventional silos. So sorry for the interruption, but hopefully that.
No, but I think that's a really important thing, and one of the reasons why we started the ConnexUS platform is that we started off with this COVID-19 response learning initiative, but fundamentally we realized that the challenges that we were seeing from COVID-19 and in the response to COVID-19 were underpinned by a lack of connection and coordination across these fields. Ultimately, we're all working towards the same goal. So how do we sort of more effectively coalesce to maximize impact? As Ellie said again, how do we get that common response to cover more ground more effectively? So we have a lot of questions coming through. So I'm going to hand over to Emily to share some of them with you.
Sure. So our first question from the audience is Lena's, and our question is, are we able to use digital tools as peace builders to help health professionals better understand and respond to conflict dynamics in the online space? Thank you for the question, Lena.
Sabina, we talked a good deal about specific digital tools. We also talked about the brilliance of WhatsApp groups and other ways where people are already connecting in order to support them in real-time processes. I don't know if it might be useful to speak a little bit about that.
Well, yeah, I think this is where, this is a critical question. And again, as Ellie mentioned, just the rise of disinformation, related to COVID-19, but also, again, we've seen related to conflict dynamics is everywhere. And then this is the sense where, again, this is where I think you need to really center and lean on local practitioners who are plugged into these spaces constantly, because there's too many WhatsApp groups, too many Facebook networks, too many, if they're in the US, too many TikTok channels, to monitor, to really get a sense of what's going on. But I've seen some really innovative use of digital tools in Haiti among peace building practitioners to monitor conflict dynamics, respond to them, incorporate that into their COVID responses. So I think because online spaces are so, they're so tied to and reflective of the social networks that underlie them, it's really, I think the answer is yes, but I think it's going to look so different from each context. And that's where I think we really need to rely on the kind of the wisdom and perspective of local peace builders and local public health agents and local humanitarians in this sense. I'm not sure if that's a brilliant answer to your question, Lena, because I was like, it depends. It was like, I feel the answer I give most often, but I think it's a critical question and we need to ask it everywhere we go.
I know, Ellie, you had made a comment in response to Lena in the chat.
Yes. Yeah. I also want to respond to a question, a very good question by Saurav about. It basically talks about using these tools in assessing conflict sensitivity, and for those ones who may have a hard time to interact with our website Adaptations, one of the tools we are trying to we are promoting an approach is actually using public policy lens to look at to assess the impact of interventions in peace building, and not just like it's been observed here. But it's not just a health issue, but using that lens across a broad spectrum of interventions. So yes, such digital tools exist, like the Irene Peace Building database that was co-authored by one of the co-founders of Save the Beat, the Sadija Dabit. Number two, when we make when we look at conflict sensitivity, you're looking at basically this broad spectrum of indicators that guide us and guide in our intervention. And yes, like even the gun violence, if I was to look at the US context, there are so many ways that you can look at each and every issue, and from a perspective of a public policy. And I think even the ongoing debate, for example, what was happening about defunding or defunding the police in America, is basically a response to a public health, to a public policy issue relating to how policing is done. So yes, these opportunities do exist, and like I said, it's all a matter of looking at the lessons that actually that are available. And then lastly, it's all about with conflict early warning is all about improving our social sensing and social listening, so that now what we do becomes more accurate, and more, we start on a sure footing on how we respond to some of the issues. And I think that's about it.
Okay, well, you know what? We're at time. Time flies when you're having fun, especially when you're hosting the first ever ConnexUS Live discussion. So I just want to thank everyone for your time today. Thank you for joining us. Thank you for being a part of this groundbreaking, history-making discussion on conflict sensitivity and public health emergencies. And a special thank you to Sabina, Ruth, and Ellie. Not many of you will know this, but as this was our first webinar, our first discussion, we kind of had to work through what it was going to look like. And we couldn't have worked through it with better people, full of ideas, very flexible, and we really appreciate your support. And I also want to sort of give a special thank you to the European Union and the European Union's instrument contributing to stability and peace. They support the ConnexUS platform and these ConnexUS Live events. So without them, none of this would be possible. So I really appreciate their support. As we close, I have 2 calls to action for our audience. The first is to visit connexus.org, cnxus.org. And I know Emily will put this in the chat function right now. We have just launched ConnexUS back in January. We're continuing to grow and develop the platform. So please feel free to sign up. It's free. Build your profile and join a community of people changing the world. You can find out about new events, contribute to the discussion forums, and we can more effectively better coordinate our responses to complex global challenges. This isn't just a peace building platform. It's a platform for everybody working to make a difference in their community. The second, this is the first ConnexUS Live event. Do you want to host the second? If you're interested in sharing lessons learned or research questions from your own work, we have a form that you can fill out to be considered as a speaker at one of our future live events. We're going to place a link in the chat function again, and we'll also send it out in a follow-up email. So once again, you can be one of our guests, be one of the first hosts of ConnexUS Live. So yeah, thank you everyone. Thank you all for joining. Let's finish on the hour perfectly. And yeah, please visit connexus.org.